Good morning. Today we will discuss about the head injury, and this talk will be mainly for the general awareness of the public and for the general physician. We know the head injury has become as an epidemic. It has a very large burden on the society because of the fast urbanized life of the population, number of increasing accidents in the society. So, we should know basics about the head injury. Head injury we mean the brain injury, mainly the brain injury, and usually there is no clear cut definition for the head injury, but we considered head injury where there is loss of consciousness mainly for the 5 minutes after the accident or trauma. Head injury we classify the simple head injury and compound head injury. There is nothing like simple head injury, but compound head injury where there is the depressed fracture with CSF, CSF leak from the nose, ear, that we consider as a compound head injury. Usually head injury severity we assess according to a particular scale, the Glasgow Coma scale. For the general public, we should know that the real sensorium of the patient that determines the severity of the injury. It may be mild, moderate or severe type. Although we know that by the proper assessment and proper diagnosis and treatment of head injury, now we can save the up to 80 to 90% of the patients of head injury. There is one important quotation from the father of the medicine, Hippocrates. The head injury is no head injury is so minor to be neglected and not severe to be given up. That means even the minor head injury should be observed cautiously. We should always assess for the general public also. We should know whether the person is fully aware after the accident, after the trauma, where he is in complete senses. If there is loss of sensorium, there is vomiting, the persistent headache, if there is giddiness, in any parts there is paralysis, if the patient gets fits, convulsions, in that patient must be observed basically under the neurosurgeon's care. For the head injury diagnosis, the CT scan head is the investigation of choice. I think for the head injury, doing the CT scan, we should have a very liberal policy, because we know that head injury patients, most of the head injury patients, by timely diagnosis and treatment, we can save up to 80 to 90% of the patients. So, and now the CT scan is available, very widely available. Previously there was situation it was available only in the larger cities, larger town, but now it is available in smaller town, in mandis also. So, we should get if there is any suspicion of head injury after the accident or any type of injury to the head, we should get the CT scan. Regarding the management part and the treatment part, as a first in the treatment, the ABC of, there is one term, there is a ABC of the life support. That means A stands for airway, B for breathing and C for circulation. That we should, even by doing the referring the patient to the neurosurgical centers for the CT scan, after any accident to the patient, ABC, maintaining the airway, maintaining the breathing and the proper circulation, maintaining the blood pressure of the patient, that is very important. Even if these things are not maintained properly, it is not stabilized properly, there is no point shifting the patient for the CT scan or to the neurosurgical center. So this is the basic ABC is the basic treatment of the life support. There is one term also, the head injury does not mean clot, intracranial clot always, and clot does not mean always operation. So many small injury, small clot can be managed without operation by the medicinal treatment also. Regarding the neurosurgical treatment, any patients are having the large intracranial clot, unconscious, conscious thereafter deterioration, not improving, that patient needs operation. Regarding preventive aspects of the head injury, wearing the helmets and seat belts prevents to some extent the head injury. Although head injury, the impact of the injury, nature of accidents, that determines the severity, but wearing the helmets and seat belts can prevent to some extent the head injury part. Regarding head injury, I have already told that the patient, any patients, if there is any suspicion suspicion of head injury, that is loss of consciousness or loss of memory after the accident, that needs observation and observation at the neurosurgical center. Summarizing about the head injury, no head injury should be considered minor. Every patient after the injury, if there is any amount of loss of consciousness, any suspicion of head injury must be observed for the head injury. One. Second, the CT scan, policy of the CT scan, that should be liberal. So we should consider even in the slightest suspicion of head injury, we should consider for the CT scan, and now this is widely available, available even just within 30 kilometers, 50 kilometer distance, every places CT scan is available. So we should be liberal. And I have already quoted even in the severe head injury cases, we should not give up our hope. We should try even up to last effort. We should give so to salvage the patient. One. And head injury does not mean always operation. So even a small contusion, a small clot can be managed at the peripheral level also. That can be managed by the general physician and general surgeon, orthopedician also. So every patient does not require neurosurgical referral. But if the patient is unconscious, harboring the large clot that requires operation, patient has compound head injury with CSF leaking from the nose, CSF leaking from the ear, that patient really needs neurosurgical referral. So although there is tremendous scope in the management of head injury, in the diagnosis and management of the head injury, and for the public, general public, we should be very aware the head injury. Now by the timely diagnosis and treatment, we can salvage up to 90% of the patients. Thank you very much.